So after a partial knee replacement, the patient can expect to have some pain, some soreness, and some swelling, but our goal is to make that pain predictable and manageable. To start off, for the first, say, 2 to 4 weeks, the patient is going to be working on motion, getting back every last possible degree they can, bending and straightening the knee, working with a physical therapist to gradually increase that arc of motion. And during that time, they're gradually getting up and walking, doing mostly ambulatory things around the house, but gradually venturing out for longer and longer distances, upstairs and downstairs, inside and outside, and gradually pushing farther and farther. I would say between 6 and 12 weeks comes the bigger gains, power, strength, and range of motion. And most people, by the time they get to that 12-week mark, they're back on the tennis court, they're playing some golf, and they're starting to engage in some more active type activities. But there really is a bell curve in regards to recovery. Some patients recover remarkably fast and are back at those activities much sooner than that. Some patients need a little bit more time. A lot of it depends on the patient themselves.